Welcome to another episode of the Bandage Podcast, a weekly wrap-up of the most trending healthcare news. Each week, we'll discuss the latest in healthcare, health IT, and compliance.
In this week's episode, we discuss a new Oklahoma police mental health initiative, produce for sale covered in feces, and a doctor facing court for medical fraud. Let's wrap things up. This is episode 156 for the week of October 10th. I'm Aubrey Battistelli.
And I'm Elia Meltzer.
Before we get started, our diagnosis code of the week is V00.01XD, pedestrian on foot injured in collision with roller skater, subsequent encounter.
I'm terrible at roller skating. And
Are
so
you?
My inability to control where I'm going and how fast I'm going on roller skates means that I've probably done this to someone.
Mm-hmm. You've caused this diagnosis code. You were the reason.
Yeah, I'm not proud of it. But mind you, I was maybe like 8 or 10 the last time I got on roller skates. So
Sure, yeah. It's been a long time for me too. I wonder if this is the same diagnosis code as it would be if you were rollerblading, because I rollerbladed a lot. I didn't roller skate a lot. I wore rollerblades. I imagine it would be the same.
The skates are the ones where like the wheels are set in 4, so it kind of looks like a mini car, and then blades are the ones where they're all in a row, right?
Yes. Yep. So that's what I did. Blades are more like ice skates.
Yeah.
Because they're like in the middle. Yeah. All right, let's get into the news. When the police ask for backup. Last week, Governor Kevin Stitt celebrated the Oklahoma Department of Mental Health and Substance Abuse Services' new mental health campaign, Ask for Backup. This campaign is a suicide prevention initiative aimed at creating conversations about mental health and trauma in the law enforcement community. Ask for Backup will work in tandem with a statewide iPad initiative the agency has rolled out over the past several years. Currently, more than 5,000 law enforcement officers across Oklahoma have iPads with 24/7 access to a licensed behavioral health practitioner to assist with assessment, evaluation, de-escalation of crises, and connection to treatment. The iPads are connected directly to one of the agency's certified community behavioral health centers located statewide. I think that's a great idea. The more you can include mental health and crisis prevention in your policing, the better.
I agree. I mean, these are people who see the worst of people, who see the aftermath of what the human psyche can do. And after a while, I'm sure it adds up and it takes a toll on you. And so how do you help the people who are supposed to help everyone else? I think that the fact that all of them have an iPad and that all of them have the ability to communicate with doctors whenever their trauma decides to surface is an excellent idea. We'll have to see what comes of this, but
absolutely. I mean, I'll be interested to know how it works. The ability to have access to that sort of resource, like with the touch of a button or like immediate access 24/7 is really, really cool though. So I'm glad that they're doing that.
What happens in the toilets should stay in the toilets. The Michigan Department of Agricultural and Rural Development issued a warning on Monday, October 3rd, after a routine safety inspection revealed that Country Gardens, that's country with a K, was using raw, untreated human waste on fields where produce was grown for sale to local grocery stores and direct sales. The use of raw, untreated human waste is a violation of Michigan food law, as well as other state and federal regulations. Human waste can carry diseases such as hepatitis A, E. coli, rotavirus, and norovirus. While no illnesses have been reported yet, the officials are urging anyone experiencing symptoms such as nausea, vomiting, diarrhea, jaundice, or yellowing of the skin, fever, abdominal cramps, loss of appetite, weakness, headaches, or other symptoms of foodborne illness to seek medical care.
Ugh. This is
the
just
audacity
gross.
of some people is insane.
This is really gross. Country
Why?
Gardens, what were you thinking?
Like,
were you
how
just like
did
having people
get
like go
so
poop in
bad?
fields? Like, I don't understand. How
I
are
don't
they
understand
collecting
either.
it? Where were they gathering it?
Like, was it an accident or was this on purpose? Because like when there are heavy rains and when they're like piping grows old, then things happen, right? But how do they? Why would they continue to sell it if they knew about this accident, and if they did it on purpose, then where was their moral compass?
Right. If they did it on purpose, that's so disgusting. If they thought like, oh, well, you know, fertilizer is fertilizer. That's not really the case.
No. And it makes you wonder how long this has been going on.
Right.
Like, has it been going on all season?
Just by the way they spell country and they're like the country gardens, I'm already turned off. So, you know what?
Yeah.
I'm done. Done with you, country gardens. You're done. Next up, kickbacks kicking you in the butt. James Ewing Ray, 51, was indicted last week by a federal grand jury on charges of conspiring to pay and receive kickbacks and commit healthcare fraud. Ray is accused of 1 count of kickback conspiracy, 4 counts of substantive kickbacks, and 1 count of healthcare fraud conspiracy. Ray was the owner of Integrity Medical LLC, which marketed healthcare items and services to medical providers. The indictment alleges that between 2012 and 2018, he conspired with others to pay and receive kickbacks, to issue prescriptions and order goods and services that were medically unnecessary. The charges were then billed to Medicare and other health insurers. That allegedly resulted in federal insurers being billed millions of dollars for those tests. Ray faces maximum prison terms of 5 years for kickback conspiracy and 10 years each for healthcare fraud conspiracy and substantive kickbacks.
So this person could theoretically go to prison for 25 years because of this type of medical fraud.
Right. You have to be like what? And you go into that, like, you don't get into this field knowing that, like, I mean, oblivious to the fact that, like, there are these laws in place for a reason. Like, I'm just very confused about how somebody can just blatantly break the law and expect not to get caught.
Yeah, it makes you wonder how bad things must have gotten for this to have happened, right? Because, I mean, maybe he was like going through divorce and all of these like attorney fees were piling up, and so he had to rationalize this. Because what would go through your mind in order to stoop so low, or what would have had to happen in order to go this far down the drain?
Sometimes it's just greed. Sometimes people just want money. And they're like, hey, this is a chance for me to get a little something off the top. I can do that. I can, not even off the top. Additionally, I can take some money from people.
Well, at least now that he was caught, he will probably no longer be providing any sort of medical service, right? His license is probably going to be revoked. He's probably never allowed to work in healthcare ever again. And especially if he is found guilty, right? So this is still going to trial, so the jury still has to figure out whether he is guilty of this based on the facts, but at least he doesn't get to treat anyone else for his own benefit.
Right, that's true. Got to be careful, guys. Be careful out there. All right, and with that, let's move into our next section.
BREACH, Breach Patrol. It's a breach! All of the latest cybersecurity breaches.
Jen, welcome to Breach Patrol, where we talk about all of the breaches around the world. We don't talk about all of them, but we talk about a whole bunch of the breaches around the world. Okay, let's see. Elia, what's up?
This next one is putting efforts in the right direction. LifeBridge Health has agreed to pay $9.5 million to settle a lawsuit over a May 2018 data breach that compromised the protected health information of 530,000 patients. LifeBridge Health hasn't admitted of any wrongdoing, but agreed to the settlement, resolving allegations that it failed to protect patient information, as well as allegations suggesting that it could have prevented the data breach with reasonable cybersecurity measures. The breach compromised information such as patient names, dates of birth, social security numbers, and more. Under the settlement, affected patients can receive reimbursement for lost time and other ordinary and extraordinary losses resulting from the data breach. LifeBridge Health has also agreed to invest $7.9 million to make cybersecurity improvements, which include encryption of sensitive data, tracking software for biomedical devices, network monitoring, regular maintenance, annual security training, enhanced account security, two-factor authentication, and more.
Yeah.
So it's good that they are investing in themselves, making sure that this doesn't happen again.
Yeah.
But it kind of irks me that they had to get a breach in order for them to do this in the first place.
Yeah.
Because all of the type of information that was compromised would be PII, right? Personally identifiable information.
Right.
So this is a breach of HIPAA.
Yeah.
And so they're probably going to have to deal with the OCR and the HHS and other enforcers of HIPAA. So this isn't going to end here. Right.
It's better to make these kind of investments before there's a breach, but it's always good to know that people are being proactive after a breach. So good that they're taking the right steps. Unfortunate that it had to get to that point.
Hopefully no one's identity was stolen, because the article didn't mention if they were also providing identity theft protection and monitoring stuff. So who knows what's going on with these poor people. I mean, this is over 500,000 patients.
It's a lot of people.
Yeah.
A lot of people affected. All right, next up, schools getting schooled in cybersecurity. Details about the cybersecurity incident from 2 months ago in the Linn-Mar Community School District located in Marion, Iowa will be released quote unquote soon, according to Superintendent Shannon Bisgard. The district has not shared much publicly about the incident that interrupted phone and online communication this summer. Britannia Mori, president of the Linn-Mar School Board, informed the public that the investigation is ongoing. So that's a little follow-up from something we've talked about before, but yeah, hopefully we get some more information soon about what happened there, what's going on.
It's probably one of those instances where they don't want to reveal too much in case people start to panic and then they find out that it wasn't as bad, or then they get sued for saying that it was maybe a minor incident when it turned out to be a major incident, right? Doctors do the same thing, right? They will tell you the worst case scenario so that way you don't sue them saying that, well, you never told me it could get this bad.
Right.
So they're probably, since the investigation is still ongoing and they want to make sure they have all their facts straight, they are not saying anything publicly, or they're not able to confirm anything publicly.
Right.
Which is very annoying, probably, to the people who are affected by this breach. I mean, imagine your kid is going to school and school had a data breach and you have no idea if your child's information is okay.
Well, yeah, and it was a ransomware attack from what, just as a reminder for everybody what this is. So it was a ransomware attack that caused a bunch of technical difficulties at the school. And then, of course, they threatened to upload all the files that they retrieved to the dark web unless the user contacts them. Which, I mean, I don't know. I feel like everybody threatens the dark web all the time, quote unquote dark web. It's this it's the boogeyman of the internet.
Yeah.
But yeah, I mean, it's still interesting and kind of freaky not to know who's behind it. I mean, somebody, it looked like Vice was the name of the group behind it, but interesting, how it happened or where they got in or how they managed to lock everything down like that. But hopefully,
but why target a school? Because it's easy, or because they're having information that you want?
How's the school gonna pay you? They don't got no money. Pay attention. Public schools got no money.
Get paid so little as is. Right. Do you really think that they have the funds?
They're constantly scraping the bottom of the barrel for funding. Come on, guys. If you're gonna pick a target, pick a better target than a school.
I know, right?
Leave the kids alone.
No, well. In any case, next up is Sullivan's cybersecurity shootout. When Uber suffered a data breach in 2014, cybersecurity expert Joe Sullivan was brought in to fix things. Now Sullivan faces prison time for his handling of a very similar data breach in 2016 that happened during the Federal Trade Commission's, or FTC's, investigation into the company's security practices. Prosecutors say Sullivan actively worked to keep the FTC from finding out about the second breach, putting his reputation as a luminary in the cybersecurity world over his obligation to report the breach to regulators. Sullivan faces 8 years in federal prison on one count of obstructing the FTC's investigation and one count of misrepresentation of a felony or acting to conceal a felony from authorities. His fate now rests with the jury, which began its deliberations 2 Fridays ago. Again, someone not doing their job ethically and facing the dire consequences.
Yes, for sure. And interesting that quote unquote expert calls himself a cybersecurity expert is facing prison time. Like, if you're an expert on cybersecurity, you would think you like cared about the law, you cared about keeping things like protected and safe, but instead you're just kind of like flaunting that.
Well, what happened in 2014 was that there was like a huge breach where like all sorts of like driver's licenses numbers and a whole lot of like personal information like that were hacked, and then they put measures in place so it wouldn't happen again. And then 2016 happened, so just 2 years later the exact same type of breach happened, and Sullivan basically chose to pretend it didn't happen instead of admitting to the world that he messed up and that what he did to protect the company didn't actually work because it happened again.
Yeah.
Because he chose the selfish route, he could probably be in prison for a decade.
Yep.
We'll just have to see if they find him guilty or not.
Yep. Hopefully, at least, well, I don't know. Hopefully he won't be able to, actively work as a cybersecurity expert after this. If this is the sort of like behavior that they engage in, it's important.
Yeah, I mean, his reputation is tarnished regardless.
Right. It's just important to know that like the people you're working with are like reputable, and it's really, I'm sure it's very frustrating to work with somebody that you think is reputable and then find out that, oops, actually no, they're going to try to like hide a data breach or
they're going to lie to the government in order to protect their own skin.
Yeah, it's no good.
Don't recommend.
Right. Don't recommend. 10 out of 10, don't recommend. 0 out of 10, don't recommend. And that's it for this week's wrap-up of your weekly healthcare news. I'm Albert Battistelli.
And I'm Elliot Meltzer.
And we'll see you next week.
Thank you for listening to the Bandage Podcast produced by eTactics.